most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
And our opinion, of course, Bob.
Today we're going to talk about when to see a doctor about hip pain. Now this could be chronic pain or something else otherwise.
Right.
So,
and Bob, we're going to actually show you when to see the doctor. But if you're in that gray zone, we're going to show you some simple exercises you can do that we found to be very helpful to get you through that pain.
But that's going to be at the end of the video, so you got to listen to us. I mean, right?
They have to put up with
They
can always fast forward.
Yeah, if you want to go ahead, go to the end of the video. We'll show you some self-treatment. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, upload every day. Go to bobandbrad.com. Go to the giveaway section. We're always giving something away. This is the transition day. We're finishing one contest and starting another one. So tomorrow, you'll have it listed what we're giving away. Check it out.
Okay.
Go to facebook.com. It'll always be pinned to the top of the page, the contest that is.
Yes.
Go to Instagram, Twitter, or TikTok if you want a 60-second version of our program.
All right. So, Bob, hip pain, very common, particularly as we get older, people in their 50s, probably more so 60s, 70s, etc. Oftentimes it's arthritic problems.
Should we talk about location a little bit, Brad?
That's a good point.
You know, where is hip pain?
Right, because hip pain as well as low back pain can oftentimes be confused, not only by a person, but even the therapist or the doctors, because it's not that easy.
A lot of people think hip pain is right here, and that tends to be more back pain.
Exactly.
That's very unlikely to be hip pain. Hip pain tends to be here or in the groin. Very common in the groin.
You should show your other side, Bob.
Why?
You got your shirt's not tucked in.
Oh, it is slobby here. Oh my God.
Bob
the slob. Okay. Pain here, probably not hip pain. Pain here, hip pain. Pain here. Could be very likely hip pain too.
Right.
Especially hip arthritis.
Hip pain sometimes will refer down the leg.
Yes.
Even occasionally below the knee, but usually not. Oftentimes hip pain is focused here. If it's in the joint, that more anterior or in the front, I would say is more common, wouldn't you, Bob?
And even down the leg, it's more down the front. Wouldn't you say?
Right.
If it goes down the leg and down the back, then I start thinking sciatica.
Right. Well, we're getting off on a tangent.
Yeah, we're getting on a tangent.
Okay. So, but the thing is number one, if you fall.
Yeah, if there's trauma.
If you're trauma and you get up and it hurts, you can walk on a broken hip. It's going to hurt, and it'll be not.
We don't want you to.
No,
but we're warning you that you could have broken it and not realized it.
Right. It could be. It's not a complete fracture, green stick fracture, whatever. But if you walk on it after you fall and it continues to be painful, you really should get that checked out.
You could fracture even like the greater trochanter, which you see quite often. A little bump on the hip.
Right.
And so it's not really a fracture like through the entire bone. It's just a little piece of bone that got fractured off.
So if there's any question, any pain after a fall with particular weight bearing,
if there's trauma, you got to have it
go in there.
Out.
X-rays are simple. They're not that expensive. So make sure you take that out. Now, the next thing is night pain. Let's say you don't have any pain throughout the day, walking, whatever, and then you go to sleep and you wake up and hip pain wakes you up.
Yeah.
If it's associated with laying on it and having weight on it is one thing. But if you just, no matter how you lay and it's painful, you need to go in and get that checked
especially
out.
Like continuous night pain. Like you said, like you can't find a position to get comfortable.
Right.
You know, when you lay on your side, you can put a pillow between your legs. That definitely helps take stress off the hip.
Yep.
And don't lay on the side that's painful.
Right.
I mean, those two things can really help. But yeah, we're always the nighttime pain is what they call a red flag.
Yeah.
You know, you're always worried that there's some type of infection or something going on that's a little nefarious.
Which brings us into the next number 3: redness, swelling, a fever if it's warm around there,
or if you have a fever.
Right. Yeah. Exactly. Right. So the hip. I always have people say back in the olden days, you know, you threw the cigarette on the ground when we were kids, and then this is how you.
Yeah.
So I'd say, you know, do that with your foot. Go back and forth, and then put your hand right here, and you're going to feel a bump right there, and that's your greatotrochanter. That's part of the hip, the lateral aspect of the hip. If that part right there is tender and sore, it could be nothing more than a bursa.
Right.
A bursitis. But if it continues to be sore, even if it is bursitis, it's a good idea to go in and get it
You're
taken
getting
care
close
of.
to right on the hip joint there is what you're saying.
Right,
Yeah.
exactly.
As opposed to, again, the hip's not back here. You're not going to feel it here.
It's not in that muscle area, the
Right.
glute maximus.
So, and did you mention, especially if you have a hip replacement?
Yes,
Yeah.
if you've had a hip replacement, there's hardware in your hip for some reason, and I don't know if you understand. If you've heard, if you have an infection in your body, it'll oftentimes
The hardware attracts it.
migrate to the hardware, whether it's in a knee, a hip, or wherever it may
Happened to
be.
my mother-in-law. I mean, she got MRSA, and it was right in the knee.
She had a knee
Yeah,
replacement.
she had a knee replacement.
Right. Yeah.
Yeah.
So if you got a hip replacement and you got pain like that, redness, swelling, get in and get it checked out.
And that was, a good example where, I mean, she had debilitating pain.
Sure.
And it would not go away no matter what position. And I mean, it can drive you crazy.
And they can do a revision. In other words, take the old hip out, put the new one in. It's something you like to avoid.
Sometimes what they do is they take it out and leave it out for 6.
I wasn't going to mention that.
Okay,
Bob.
sorry, I didn't want to scare people.
I've worked with a number of people like that. Not a lot, but yeah. But you can do a revision. You like to avoid it. So get in early and get the
infection taken care of.
Exactly. The next one, consistent pain, slowly getting worse.
Sure.
You can live with it, not bothering you too much, but over a period of, I'm talking months, 6 months to a year, there's probably a good chance it's just arthritis.
It's arthritis, right.
But if you wait too long and the ball of the hip and the socket get wore out too much, it just makes it more difficult of a surgery.
Sure.
And plus you're going through a lot of unnecessary pain. How many times have you had a patient go through a hip surgery and they say, I wish I would have done this years ago.
Yeah.
I mean,
and
that's
knee surgeries too.
Knees
knee
too.
replacements.
But hips are even easier surgery than a knee.
Yeah, they are. And one thing that I found out, like my grandpa, he ended up being 94.
Yeah.
He, never went in to have his hip replaced. Ended up being non-mobile after a while. I mean, he couldn't walk at all.
Sure.
So, I mean, two things can happen. One, that can happen, or two, you can get some medical issues so that you're not able to tolerate the surgery anymore.
Exactly.
So, I mean, I'm not big on pro surgery. I definitely would try therapy first, and we'll show you some things at the end of the video.
Yeah.
But if it's time, it's time, because you're just giving up quality years of your life, and you may give up the opportunity to even do it. I mean, you may get a heart issue or something where you couldn't tolerate the surgery.
Exactly. And now it is time, Bob. It's at the end of the video. We're going to show if you got some of that chronic, slow-going pain that you're pretty sure is arthritis, and you haven't done anything about it as far as therapy. We're going to give you a couple hints, and these are we have pretty good success with them.
Yeah, we do.
Do you want to show them, Bob, or
what do you want me to show?
Let's do the supine.
Okay.
So you do this actually on your bed. Lay on your bed. If you got a really soft bed with soft sides, it doesn't work so good, but you'll have to work with that. Maybe have someone stand by you, because we don't want you to obviously fall off the bed.
So we're going to check hip flexion first.
Yeah, range of motion.
We want to see how your hip moves. So you're going to check one. You can grab on the knee like this, or you grab underneath the knee like this.
And grab the good leg, the hip that doesn't hurt.
Check that first.
Yep.
And see how far it goes. Kind of give a sense of how far it goes. Then compare it to the other leg. And if this one, you can see it doesn't go as far.
Mm-hmm.
Now, actually, this is my problem hip. I don't know if you can see any difference.
Well, bring it up.
Here's this one.
So we're going right to there.
Okay.
I'll be the spotter here.
And I'll pull on this one.
Yeah, you're off about 4 inches.
And I can feel a little bit of pain with this one, too.
Yep.
I have to massage this one daily, stretch it daily. I'm doing these same things that we're going to recommend today.
Sure.
Next one, you want to do like...
Should we show the treatment for this one?
Sure,
first?
sure.
The treatment is the same as the test.
Yeah.
You just simply work your stretches. Should we just tell them the hold and relax?
Yeah, or contract, relax, you mean? Or
no, just hold.
Oh, yeah, pressure on.
Yeah.
Pressure off.
So we're just
pressure
trying to
on,
get more range of motion.
Now you can do this. Do you want to show it on a stool, Brad? Or
oh, sure. This stool is pretty high. I'm not going
Yeah.
to recommend this to
This
anybody.
would be too high for you.
But if you go in a stairwell and you have handrails to hold on to, you have options for how high to go. I would probably
A chair with a back too. You can hold on to the
Yep.
back of the chair and you stretch like that. That's
Yeah.
that's how I like to do it.
Yeah.
To be honest with you, I do it in the stairs.
I
like you
do this
said.
for a different reason, but it's the same. Does the same in the hip. I really do enjoy this, especially my right side. But that's just my personal.
Now,
thing.
you can also measure how much the hip extends.
Right.
And one way to do that is you keep your shoulders completely on the bed.
Mhm.
You bring your legs off to the edge, and you let the one leg hang off the bed. Now I'm a little bit tall for this mat,
Right.
but you grab the other one and pull it up like this, and you can give a sense of how much this bends down. Now you compare it to the other side, and again you might find a difference. And this is the stretch you would do.
And this is yeah. And so now we're just letting gravity stretch that hip right here. This is the one. Actually, that one's getting a stretch too. So they're both sides. It's kind of like the shotgun
You're
approach.
getting the hip flexion. You're stretching into hip flexion here.
Now, if you're elderly or a little frail, weak, and you don't feel comfortable doing this one, do it with someone that's able-bodied to help you out, so you don't fall off the bed. Obviously, that's not worth it.
You can do it on your knees too. It works best with a pillow, but this floor is actually kind of soft here. So, whoops, this way, right?
Yep.
So I'm going to go ahead and just bend forward like this. This is a great stretch. I just love this stretch.
And again, for older people, maybe with knee arthritis, you may not be able to do this,
Right.
and then you just can't do it.
Right.
It's not safe.
But you put a pillow down. It helps a lot of
Yep,
people.
yep.
I actually take my hand and push my pelvis a little bit.
Yes.
And I also turn my foot out a little bit.
Yeah.
And
So right back here. That
Hold
gets that
cracked my
iliopsoas
back
muscle.
there, too.
Oh, bonus.
Get
A
to my
bonus.
age, lots of things are cracking. So
Now, this is my favorite one. The
Okay,
figure four.
the figure four.
You can do this easily on bed, anybody.
you can check it this way to see how much it bends.
So he's talking about the knee going this
That
way.
way, yeah. Now compare it to this one.
You're pretty even, Bob.
Pretty even. This one, again, I feel a little bit of pain. So I do this stretch too.
Yep.
I absolutely stretch it this way. I actually do it laying down in my stairwell again.
Oh.
I put one foot in there.
Oh.
But Brad's going to show it in a chair,
Yeah.
how you can use it.
Now I'm on a taller stool, and I can do it here, but it works better in a typically 18-inch size standard chair.
Like this
like
works
Bob
for me,
has.
yeah.
Yep.
Just pressure on, pressure off. What's nice, you can do this throughout the day.
Yeah.
Yeah.
And you can see you can do this without workout clothes on.
Yep.
The ones laying in the bed, you have to make sure you have pants that are not
Loose.
tight,
Right.
especially when you do the hip one where you have the knee off the bed. I was going to mention that, but Bob wouldn't stop talking.
It's amazing what a difference this can make. I honestly, although we just said that a lot of people wait too long, I think some people could have waited longer if they would have stretched their hips out.
With
And
less pain.
With less pain.
Right.
Their quality of life would have been a lot better.
Exactly. Yeah, this
So-
figure four one, whether it's seated or laying down, I think is one that really can do some good for people.
Yep. Give her a shot and let us know in the comments below how you did. Remember,
There you
Brad
go.
and I can fix just about anything.
Except for,
A broken heart.
that's right.
I think if Brad would uphold his, then we get it done. But
I
he's
know,
just
Bob,
slacking.
but I'm busy. I got things to do, and I don't always
bet you
think.
do.
Yeah.
All right, thanks for watching.